This Medical Minute is brought to you by Good Samaritan Hospital.
Some of the common myths about female incontinence are, well, number one, that it's just a normal part of getting older or a normal part of having had children, which isn't the case. Women don't have to suffer with these problems. They don't have to feel like it's just something they have to live with. Another common misconception about incontinence is that there's not good treatments or the treatments aren't durable. And in fact, we've come a long way in treatment of these problems in having very good success rates over the long term. Urinary incontinence in women is very common. Actually, prevalence studies have shown up to 40% of women can suffer from some form of incontinence. The two most common kinds of incontinence for women are stress urinary incontinence and urge-related incontinence, also known as overactive bladder. Stress urinary incontinence is incontinence that happens with a stress such as a cough, a sneeze, laugh that causes an increase in pressure on the bladder. It's commonly caused by things like childbirth, aging, menopause, gravity, and genetic predisposition. The second most common kind of incontinence in women is overactive bladder or urgency, frequency, and urge incontinence. And that has to do with a spasm of the bladder wall that leads to an inappropriate sense to go to the bathroom, or sometimes an inability to control urine on the way to the restroom. Urinary incontinence can have a negative impact on women's quality of life. It can lead to avoidance of certain activities, sometimes fear of leaving the home. The good news is there's great treatments available now that can really improve the quality of life in most women. One of the most exciting advancements in treatment of stress incontinence has been a sling placed under the urethra that can be done in a 30-minute procedure under local anesthesia and is highly successful at curing stress incontinence for women. The Good Samaritan Women's Center for Specialized Care is an excellent option for women with urinary incontinence because we have nationally recognized experts in diagnosis and treatment of these problems. We have state-of-the-art imaging to help with the diagnosis, and we also have a multidisciplinary team that includes physical therapists and acupuncturists.
For more information about solutions for female incontinence, call 513-862-1888 or visit goodsamcincinnati.com/women's center.